systems fail all the time and that the silos of care are becoming more siloed as opposed to cutting across them. We as social workers, I think a big part of what we try to do is help patients and families navigate that complexity of the system. It takes an interdisciplinary team to provide the best care with the patient and family as the center of that team. And I think a lot of the models of care that are being developed through the healthcare reform efforts are very exciting, but if we forget that, I think we're going to be back in the same situation 10 and 20 years from now of not meeting the needs of people with multiple chronic conditions. It really, unfortunately, takes an advocate to kind of work the system at times, and when they don't have that, it's much more complicated, and I think their health outcomes are diminished as a result, absolutely. So when you can find that or make those resources happen, it makes much more sense. We've started a program at Rush in the last 4 years where our social workers, including myself, call people after they leave the hospital within 48 hours, and even services that were put in place upon discharge from the hospital sometimes fall apart once people get to the community. Maybe they didn't get the communication, the agency that was supposed to serve them couldn't read the writing of whoever sent it, whatever it may mean. Part of it is we don't have a more network coordinated virtual system of communicating. But what ends up happening then is the person goes home, they don't get the services they need, they begin to fail at home again, they end up back in the emergency room, back in the hospital, or unfortunately maybe in a nursing home unnecessarily when some simple kinds of things to address what they were experiencing, if they had known who to call or if they had had a contact point person, it would have made a big difference.